Hi, it's Dr. James Porter again. Today, I want to talk about something that doesn't get mentioned enough, how arthritis changes the way we eat. You see, most people think arthritis just means joint pain, but the truth is, it affects everything, including what's on your plate and how it gets there. Here's something you might not know. According to the CDC, over 25% of adults with arthritis have trouble preparing meals or grocery shopping because of joint pain. That means millions of people are skipping meals, avoiding cooking, or relying on unhealthy food not because they want to, but because it simply hurts too much. Maybe that sounds familiar to you. Maybe you've stood in the kitchen staring at a bag of rice thinking, I just don't have the energy to cook this tonight. Or maybe opening a jar, peeling vegetables, or standing over the stove feels like too much. So you reach for whatever's easiest and not necessarily what's best for your joints. I get it. I've seen it again and again in my patients. Pain has a way of turning small tasks into big barriers, and over time, those skipped meals or poor food choices can actually make the inflammation worse, keeping you stuck in the same cycle. But here's the thing. What if the food itself could help? What if just changing the type of rice you eat, not cutting it out, not dieting, just switching the kind, could reduce the inflammation in your joints and help ease that daily pain? Today I'm going to show you exactly which types of rice do that and why. These aren't trendy superfoods or hard-to-find ingredients. They're simple, affordable, and sitting on the shelf of nearly every grocery store. If you've been dealing with arthritis for years, I want you to know something. It's not too late to feel better. Your next meal can either add to the pain or help calm it down. So if you're ready to take back control, starting with your plate, stay with me. You might be surprised by what a small change can do. And if you find value in this video, I invite you to subscribe. That way, you'll always have a place to come back to for practical, honest advice that puts your health first. Let's get into it. If you're dealing with arthritis, you need more than just pain relief. You need real repair. And few foods support joint healing as powerfully as wild rice. It's not your typical rice. In fact, wild rice is technically a seed, but don't let that fool you. It's one of the most anti-inflammatory, nutrient-rich grains you can put on your plate. And for aging joints, that matters more than ever. Let's start with the big one, omega-3 fatty acids. Yes, the same healthy fats you hear about in fish oil, wild rice contains them too in plant-based form. And omega-3 second aren't just good fats. They actively help suppress the enzymes and cytokines that trigger inflammation in the joints. A 2020 review in Nutrients Journal found that omega-3 second can reduce levels of interleukin, 1-IL-1, and tumor necrosis factor alpha, two key chemicals that drive joint destruction in both osteoarthritis and rheumatoid arthritis. What does that mean for you? It means less swelling, less stiffness, and potentially slower joint degeneration, all from a food you can enjoy in a warm, hearty bowl. But omega-3 second aren't the only heroes here. Wild rice is also high in zinc and manganese, two minerals your joints depend on. Zinc plays a crucial role in repairing damaged tissue, especially the cartilage that cushions your bones. A deficiency in zinc has been linked to worse arthritis symptoms in older adults. Meanwhile, manganese is essential for the production of collagen, the flexible protein that makes up tendons, ligaments, and cartilage. I had one patient, George, in his late 62nd, who had been dealing with hip pain for years. After we added wild rice to his diet, just a few servings a week, along with some other minor changes, he told me, "Doc, I'm not dancing, but I can get through a walk without feeling like my legs are crumbling." That may not sound like much, but to him, it was freedom. Wild rice also brings something else to the table, antioxidants. Specifically, it contains phenolic compounds, which fight oxidative stress, another major player in chronic joint inflammation. When your body is overloaded with oxidative stress, the lining of your joints can become inflamed, leading to pain and long-term damage. But phenolics help neutralize those harmful free radicals, protecting your joints on a cellular level. In fact, A 2018 study published in Food Chemistry showed that wild rice had significantly higher antioxidant activity than both brown and white rice, making it a standout choice for anyone looking to calm inflammation naturally. Now, I know what some of you might be thinking. Sounds good, but is it hard to cook? Not at all. Wild rice does take a little longer to prepare, about 40 to 45 minutes, but it's worth the time. It has a slightly chewy texture and a rich, nutty flavor that pairs well with almost anything. You can toss it into soups, mix it into grain bowls, or serve it alongside roasted vegetables and lean protein. It's satisfying, easy to digest, and gentle on sensitive joints. And no, you don't have to eat it every day. Even 2 to 3 servings a week can begin to shift the balance in your body from inflammation to repair. So if you've been looking for a natural way to support your joints, not with another pill, but with real food, wild rice is a smart, science-backed place to start. In the next section, we'll dive into a type of rice that used to be reserved only for emperors. It's rich, powerful, and loaded with compounds that protect your joints like armor. Stay with me. You'll want to know about this one. If wild rice is your internal repair crew, then black rice is your body's shield, protecting your joints from damage before it begins. Black rice may not look like much on the shelf, but it's not your average grain. This isn't just any rice. Once reserved for emperors in ancient China, black rice earned the name forbidden rice. Today, science helps explain why. Its deep purple color comes from anthocyanins, powerful antioxidants, also found in blueberries, but in higher concentrations here. These anthocyanins are inflammation fighters. According to a 2017 study in the Journal of Agricultural and Food Chemistry, anthocyanins have been shown to block COX-2 enzymes, the same enzymes targeted by arthritis medications like ibuprofen. That means every spoonful of black rice is quietly reducing the same inflammatory process that causes joint swelling and pain. It doesn't stop there. Black rice also helps reduce pro-inflammatory cytokines such as TNF-alpha and IL-6, both of which are known to accelerate cartilage breakdown in people with arthritis. Lowering these markers means calmer joints, slower damage, and less stiffness over time. Another reason I recommend black rice: plant-based protein. It contains more protein than white or even brown rice, and that's critical. As we age, we lose muscle mass, especially if joint pain limits how much we move. That muscle loss places more pressure on joints, increasing pain. Protein helps maintain that muscle cushion around your joints, so they stay supported and stable. Black rice is also rich in iron, a nutrient many older adults fall short on. Without enough iron, your body can't transport oxygen efficiently, which leads to fatigue, slow recovery, and poor tissue repair. That's not good news when your joints are trying to heal. One of my patients, Susan, 72, once told me she was tired of feeling stiff, weak, and foggy. We made a few small changes, including swapping her white rice for black rice a few times a week. A month later, she said, "I didn't think food could make that big of a difference, but I feel lighter, less stuck." That stuck feeling, many of my patients know it too well. Black rice also contains fiber, which supports gut health, and a healthy gut plays a role in managing inflammation. It also has a low glycemic index, meaning it helps stabilize blood sugar, and that matters because sugar spikes are known to trigger systemic inflammation in the body, including the joints. So how do you eat it? It takes a bit longer to cook, about 30 to 35 minutes, but the result is rich, nutty, and satisfying. You can toss it into roasted veggie bowls, add it to soups, or even enjoy it as a lightly sweetened pudding with coconut milk and cinnamon. It's flexible, flavorful, and most importantly, healing. You don't have to eat it every day. Just 2 to 3 servings a week can tip the scale in your favor. It's one of the simplest ways to support your joints without changing your whole lifestyle. Up next, we'll talk about a rice you probably already have in your pantry, one that's often underestimated but loaded with nutrients that your muscles and bones depend on. Stay with me. So far, we've talked about 2 powerful and maybe unfamiliar types of rice. But now, let's bring it closer to home. You may already have this one in your pantry: brown rice. It's easy to find, affordable, and often overlooked. But when it comes to arthritis relief, it's a quiet powerhouse that deserves a second look. What makes brown rice different from white rice isn't just the color, it's the layers. White rice has been stripped of its bran and germ where most of the nutrients live. Brown rice keeps those layers intact. And inside them are key nutrients that directly support joint health. The first one I want to highlight is magnesium. Magnesium plays a major role in muscle and nerve function. For people with arthritis, tightness around the joints can be just as painful as the joint itself. Magnesium helps relax the muscles surrounding the joints, reducing pressure and stiffness. It also supports neuromuscular coordination, which is especially important as we age and need more balance and stability. In fact, a study in the American Journal of Clinical Nutrition found that higher magnesium intake is associated with lower levels of C-reactive protein, a blood marker linked to inflammation. That's real, measurable impact from a mineral you can get right from your plate. Brown rice is also rich in fiber, and not just for digestion. Soluble fiber feeds healthy gut bacteria, and your gut and joints are more connected than you might think. A healthy gut helps regulate the immune system and reduce systemic inflammation, the type that fuels arthritis flare-ups. One 2021 study published in Frontiers in Immunology confirmed that improving gut health through dietary fiber led to reduced inflammatory markers in patients with chronic joint conditions. Then there's manganese, another essential mineral found in brown rice. Manganese helps the body produce collagen, the protein that forms cartilage, ligaments, and bone tissue. As cartilage wears down in arthritis, the ability to rebuild becomes critical. Manganese acts like a construction foreman, making sure those structural materials are in place. But there's one more benefit people rarely talk about: blood sugar control. Spikes in blood sugar don't just affect people with diabetes, they also promote inflammation. Brown rice has a low glycemic index, meaning it digests slowly and keeps your blood sugar steady. That means fewer inflammatory surges throughout the day and less stress on your joints. One of my patients, Bill, 68, had switched to white rice years ago because it cooked faster. But after he started eating brown rice regularly in soups, stir-fries, and grain bowls, he noticed something simple but powerful. I'm not as sore in the morning. I don't wake up feeling like I've rusted overnight. That morning rust is something many arthritis sufferers know all too well, but it doesn't have to be permanent. Cooking brown rice is simple. It takes a bit longer, around 40 minutes, but you can batch cook it for the week. Mix it with steamed greens, grilled fish, or roasted vegetables. It holds flavor well, adds texture, and fills you up without the crash that comes from processed carbs. If you've felt stuck, like your joints are tightening day by day, brown rice offers a slow but steady push in the other direction. Less stiffness, more energy, better support for the muscles and bones that carry you through each day. And in the next section, I'll show you how to combine all 3 rice varieties into an easy, repeatable routine. No complicated planning, no strict diet rules, just small changes that add up to real relief. See you there. By now, you've seen how 3 simple grains, wild rice, black rice, and brown rice, can do far more than fill your plate. They can support your joints, ease inflammation, and help your body recover from the inside out. But let's be honest, knowing something is good for you isn't the same as actually making it part of your life. I've had many patients say, "Doc, I get it, but how do I make this work when I'm tired, stiff, or just trying to get through the day?" That's a fair question. And the answer is, you don't have to overhaul your entire diet. You just need to start small and stay consistent. Here's how to make it simple. Start with 1 grain per week. If wild rice is new to you, make a small batch on Sunday, store it in the fridge, and add a scoop to your lunch or dinner every other day. Maybe in a salad, maybe in soup, maybe just next to some roasted veggies. Keep it easy, keep it realistic. The next week, rotate in black rice. Use it as a base for a stir-fry, or even try it in a breakfast bowl with cinnamon and fruit. Remember, this is about support, not restriction. You're not giving things up. You're adding the right things in. Then move on to brown rice. It's the most familiar and versatile. Pair it with lean protein, cooked greens, or warm stews. It holds flavor well and makes meals more filling, which also helps with energy and blood sugar control. Now, here's something important. These grains don't need to be eaten every day to be effective. Even just 2 to 3 servings a week of each variety is enough to shift your body toward a lower inflammation state. Think of it like a steady drip of nutrients, rebuilding and protecting your joints meal by meal. If you're short on time or energy, look for pre-cooked or frozen options. Many grocery stores carry cooked, wild, or brown rice in pouches that heat up in 90 seconds. And if cooking is difficult due to joint pain, don't hesitate to ask a family member for help prepping a batch at the start of the week. That small support can go a long way. A few more tips I often give my patients. Cook with broth instead of water to boost flavor and add extra minerals. Add a drizzle of olive oil or a sprinkle of turmeric for even more anti-inflammatory benefits. Combine the grains together, wild, black, and brown, for a nutrient-rich arthritis blend you can enjoy all week. This isn't about perfection. It's about building a routine that works for your body, your kitchen, and your lifestyle. You deserve meals that don't just fill you up, but actually help you feel better. These rice varieties offer that. And in the next part, we'll bring it all together, what it means to take control of your joint health, one simple habit at a time. Because it's not too late, you're not too far gone, and every grain counts. If you've made it this far, I want to say something from the heart. Thank you. Thank you for staying with me through every grain, every explanation, every small step we've walked together. Because what you've done by watching this isn't small, it's a choice. A choice to take your health seriously, to believe that change is still possible, and to start looking at your meals not as a burden, but as an opportunity to heal. Here's what I want you to remember. You don't need to chase complicated diets. You don't need to take 5 new supplements or give up everything you enjoy. What your joints need, what your body is quietly asking for, is consistency, nourishment, and care. And something as simple as rice, wild, black, or brown can be part of that care. Every spoonful is a chance to fight inflammation. Every bowl is a chance to support the tissues that carry you through life. Every small effort you make in the kitchen sends a signal to your body. I'm still here. I still want to feel better. I've seen people in their 60-second, 70-second, even 80-second shift the course of their pain not through miracles, but through steady, daily choices. You can be one of them. If you've been waking up stiff, avoiding stairs, struggling to move without wincing, you are not alone. But you're also not stuck. This is your body. These are your meals. And starting today, they can work in your favor. So, here's my gentle encouragement. Pick one rice. Add it to your grocery list. Try it once this week. Notice how your body responds. Then, build from there. If this video gave you even one helpful idea, I hope you'll consider subscribing to the Golden Health channel. That way, whenever you need support, guidance, or just a calm voice to help you sort through the noise, you'll know where to find us. And if you've tried one of these rice varieties already, let me know in the comments. Your experience might just inspire someone else to take their first step. Take care of your joints, take care of yourself, and I'll see you in the next video.